Let's explore prednisone, one of the most powerful and widely used steroid medications in medicine. Prednisone is a corticosteroid, not to be confused with anabolic steroids. It works by suppressing the immune system and reducing inflammation. Doctors prescribe it for a wide range of conditions: autoimmune diseases like lupus or rheumatoid arthritis, asthma or COPD flare-ups, severe allergic reactions, certain cancers, even after organ transplants to prevent rejection. It mimics cortisol, a hormone your body makes, and helps calm an overactive immune response. Dosing varies widely, from short courses to long-term tapering plans. It's often taken as a tablet once daily, with food. Short-term side effects include insomnia, mood swings, increased appetite, and long-term risks include weight gain, high blood pressure, high blood sugar, weak bones, osteoporosis, suppressed adrenal gland function. Key rule: never stop prednisone suddenly. It must be tapered off slowly under medical supervision. Prednisone can be life-saving, but it's not for casual use. Always take it exactly as prescribed and let your doctor guide any changes. If you found this helpful, hit subscribe for more medical animations.